I'm Dr. Haddock, and this is Aries, and we're here to talk to you about feline osteoarthritis. It is a very common problem in elderly cats, and it often gets missed because cats don't always show us the signs that we expect with pain. They're very stoic. So some of the things that you might notice in your kitty with arthritis would be litter box issues. Sometimes they just start going outside the box all of a sudden because it hurts them to climb in. They're just not jumping on the furniture they used to jump on, maybe the counters, maybe like high pieces of furniture like the bed. Sleeping more. Sometimes people just come in and they say, yeah, they just sleep all day. They don't really play anymore. And aggression. Sometimes just all of a sudden out of the blue, your cat might be more bitey, scratchy, more reactive than usual. They can't tell us that they hurt, so sometimes they just react because the things we're doing, like petting, are hurting them. And then sometimes they stop grooming. So their coat might get unkempt if they're short-haired, or if they're long-haired or even medium-haired, they can just mat up, and that can be a bad problem. We want to test for this basically by treating them for their pain. And what we are very grateful to now have is Solensia, which is labeled for arthritis in kitty cats. It's an injection that's given once a month. You want to give it 2 months worth to let it reach full effect and see if it helps your kitty. It's given subcutaneously, so under the skin, like a vaccine, either up there or sometimes we'll give it back there. It lasts about a month, and they can come in every month and get it if it helps them. So this is wonderful because a lot of cats will not take meds by mouth. It's just not a good option. It's not possible. So this is a really great option for those kitties. It seems to be well tolerated in our patients with kidney disease, which has been a major problem because many of our elderly cats also have kidney concerns. So in the past, we have been very limited. We have things like Onsior, which is a non-steroidal anti-inflammatory, very good for arthritic pain, but Onsior is only labeled for 3 days. So that's not enough for a kitty living with chronic arthritis. And then gabapentin can also be helpful for pain problems, but it is not an NSAID, so it's not good for inflammation, and it has to be given every day, sometimes twice a day. It's a big capsule. It's not ideal. Meloxicam is another NSAID, but it is not labeled for cats, and in fact, it can have some pretty serious adverse effects when given to kitty cats, so we will reach for it when we have to, when it's a quality of life issue, but this is not usually given long-term in kitty cats. It was really great a few years ago when Solensia came out for this problem. It gave us a new tool to directly treat arthritis with a monoclonal antibody type drug that doesn't have the effects on the kidney that meloxicam does.